One of the world's most lethal conditions can actually be detected by tasting a patient's pee. That's right, people with uncontrolled diabetes have pee that has a distinct sweet taste. In fact, the technical term for diabetes mellitus, comes from the Latin word for sweet like honey. In the 7th century, an Indian physician by the name of Sushruta wrote about the sweetness of urine in diabetic patients. But it wasn't until the 17th century when a British physician by the name of Thomas Willis rediscovered this sweetness that was in the pee of diabetic patients. And at that point, the term mellitus was added on to the end of diabetes. But did you know there's actually 2 kinds of diabetes, and they're actually quite different? So what's the difference between type 1 and type 2 diabetes? Over the next little bit, I'm going to give a short overview of the disease that will affect 1 in 3 Americans, and a little tip that can help manage their condition. Type 2 diabetes is often diagnosed at around 45 years old. But if you go to a doctor and end up with a diabetes diagnosis, they'll likely put you on some drugs, tell you to lose some weight and eat healthier, and send you on your way, which isn't always entirely helpful. See, type 2 diabetes is a horrible condition, but it's completely treatable and preventable. And the main issue of diabetes stems from a condition called insulin resistance. Insulin is a super important hormone that's like a key that allows the sugar from your blood to enter into your cells. And when your body experiences high levels of blood sugar over extended periods of time, it ends up having high levels of insulin over extended periods of time. And as your blood sugar creeps up, your insulin creeps up. And just like an alcoholic that needs more alcohol to get the same buzz, you end up needing more insulin to get the same effect. And thus, you become insulin resistant. Some telltale signs of a person who's insulin resistant and type 2 diabetic would be fatigue, skin tags, excess belly fat, decreased libido, erectile dysfunction, and so many other things. Many type 2 diabetics use strict nutrition plans and medications to manage their disease. But from what I've observed, one of the most simple things that a type 2 diabetic can do to manage their disease is to make sure they're getting adequate amounts of fiber in their diet. So if you know someone who's a type 2 diabetic, send this to them and have them tell me if I missed anything and let me know if they've heard this fibery tip.